leadership, healthcare, and the well-being of mothers, children, everyone in fact. Today on Your Voice Africa, let's shine the spotlight on a medical professional who's redefining healthcare delivery and management in Nigeria. It's so good to have you here. Let's take a breather and get right back. This is Your Voice Africa Women on Dott TV right here. Women's voices matter, their stories inspire, and their impact shapes society. I am Ifi Arono, and it's so good to have you on the program today. Now, there's been a lot of concern over the state of healthcare institutions and infrastructure across Nigeria. There's been medical tourism, and the Japa syndrome is at an all-time high. This is affecting qualitative healthcare delivery across the country. Well, our guest today brings a breath of fresh air and a dynamic perspective to healthcare management in Nigeria. Dr. Peace Igosewe is the Chief Medical Director of the Asaba Specialist Hospital and a pediatrician. Doc, it's so good to have you. You're welcome to Your Voice Africa.
Yeah.
Oh, wow. So first, let's get into it. And looking at you, when I was told about you and the work that you're doing, I'm like, oh, she's young. So, and when you hear CMD, it's usually older people. So talk to us about how you became a chief medical director this young.
Well, relatively young. I think it was just divine providence. I became a consultant. I did my residency at Federal Medical Center, Asaba. And then I became a consultant, and I got employed by the Hospital Management Board, and I was posted to Okwe General Hospital, down towards Onitsha. And it was an experience. But within a year of being there, I was sent to Asaba Specialist Hospital, which was just starting at the time, to just pick some people from different facilities and sent us there.
What year was it?
2019.
Okay, 7 years ago.
Yeah, 7 years. It's been a while.
Wow.
It's short. It's run by so fast, actually. It's been a very busy period. So at the time, we're just about 50 persons who were sent to start the hospital. And we're just doing 8 a.m. to 6 p.m. services, catheter services. And I think by November, the person who was the MD, acting MD then, was transferred out of the hospital, and I was made acting MD. I never imagined I'll be MD, quite frankly. It was not part of my dreams at all. I tend to shy away from leadership, but you are shocked. But it just somehow comes naturally. It's not, that's just what happens. I don't like being in the spotlight. Anyway, so I was made acting MD because of period. COVID came. And Ash, because we were doing skeletal services, we had so much empty space. All the wards were empty. So Ash was the center made to, the major center for COVID in the whole of the state. So it was an experience managing the COVID center.
When you say ASH, I need people to know that it is Asaba Specialist Hospital, the acronym.
So Asaba Specialist Hospital was just starting at the time. We're just 50 staff. So the wards were all empty. We have about 15 wards in the hospital, all empty. So naturally, the state just had like a ready-made place. It was fully equipped and all, but there were no staff, no patients, were not started fully. And
so the state started ready
for COVID. As in, we managed over 400 COVID patients during the period. Yes.
From within and outside.
Within and outside, mostly within the state. Then when COVID came, everybody was managed inside the facility. So it was quite an experience from children. We're bringing them from across the whole state. We're feeding them, taking care of their medicals, their utilities, everything. So it was a very wholesome experience. And
there were recoveries, I believe.
Yeah, of course. We had some deaths, but there were quite a number of recoveries. Very, very many. Yeah, it was an experience. So it was like an introduction into leadership.
I get it.
Before then, we're just like
imagine how you were introduced to leadership with COVID of all things.
I'm telling you, it was an experience. Let me just summarize it by saying it was an experience. But it was good because it made me realize that the hospital could actually run in full capacity because
Okay.
before then, everybody was like, they need to employ 1,000 people, need to do this. But before we start, I was like, we need to start gradually and grow, which is what I have done over the years. Because as soon as COVID ended, the epidemic ended. I mean, is it pandemic now?
The
COVID.
pandemic. Yeah.
So as soon as it ended, I had to make advocacy to the government that we need to start this hospital. There's no perfect time when everything will be just there and we'll just come into a ready-made hotel hospital and start. Let's start small. So, and the government bought the idea. So we did employment, employed about 200 persons. We started the hospital. So initially we started with people who were contract staff. They were later converted. We were like, okay, let's focus on mother and child. So we opened A&E for adults medicine. Then we opened the maternity complex comprising of the maternity ward, the NICU, neonatal intensive care unit, and the labor ward.
Okay.
So that's how we started. And then the theatre too. So we've grown over the years. I think gradually, every time we got beyond the capacity where we were at, we somehow knew it was time to go bigger.
Okay.
So within a year, we had opened practically all the wards in the hospital.
Wow.
And currently we have 16 wards presently, have almost 1,000 persons working with us. We've come a very long way. It's been quite an experience. And because I was just a year plus into being a consultant, it was just being at the right place at the right time and just divinely orchestrated that I was called the medical director.
Were you the only consultant at the time?
Yeah. No, not really. We're four. We're four.
So what was the distinguishing factor? What made you naturally, the chosen one at the time? What do you think?
I don't know. Okay. Maybe my commissioner at the time will know, but I was just asked to head the hospital, and then after acting for about a year, I was made substantive CMD. Okay. So this is my second tenure as CMD of the hospital.
Fantastic.
And, it's been a journey because everybody talks about ASH today, but we did not just start as a specialist hospital. We've grown from the basic to where we are today. We're still growing. Yeah. I believe in continuous improvement.
Growth and improvement.
And growth, yeah.
That's right. Before we continue, because there's so much more to talk about, let's take a breather and get right back. Yes, our spotlight is still on ASH, Asaba Specialist Hospital, and the CMD, the Transformer, is right here with me in Dott TV studio, Asaba. Now, talk to us, Doc, about the transformation over the years. Talking about how you came into the role, you actually grew into it. You did not resume work thinking you would become CMD, but it happened within a short time. Were there things that growing into the role, you began to see, oh, this is necessary to do. These are the things I want to be remembered for. What are your legacy ideas or initiatives at the hospital?
Okay. Well, I practically started the hospital from 9 months in existence when I became a medical director and then subsequently CMD. And I grew the hospital like a child. Oh. It's become an adult now, a very big adult who hardly listens to me. But it's, I cannot say this is the milestone accomplishment because it's quite a lot from having to come up from being, the hospital was set up to be a central hospital. Okay. That's just like a little bit above a general hospital. But I suppose I don't do basic. I don't know how to be mediocre. So, and I don't know how to just relax and be content with where I am. I just need to keep moving. That's just me. And I came to realize that I am quite ambitious in terms of getting things done. You know, I don't just I'm not kind of person that just says, okay, this is how it is. We just have to accept it like that. No, I want to find a solution. I want to find how can we do this better? How can we be different? We have limitations. We're in Nigeria. Yes, we have power limitations. We have manpower issues. We have technological know-how issues.
That's right.
There's so much. And then we are Nigerians have this innate belief that where you are is where you must eat.
That's right.
Yes, so there's that too. There's so much to do with, and then the fact that I'm a woman.
Oh,
Yeah,
yes.
it was a major issue.
I
It
wanted
still
to talk
is.
about that even when you were chosen, because
Yeah.
I'm sure there were men who
Yes.
could have.
Yeah, they were. Well, it's just been a lot to navigate through. But there's no saying this is my milestone accomplishment, because I see the whole hospital. We've grown. We now have a dialysis unit. We do dialysis. We've done over 400 dialysis sessions for our patients in less than a year of setting up the center. We'll have we produce our own oxygen, have our oxygen plants. Yes, yeah. So we don't. After COVID, the government provided us with an oxygen plant. So over the course of the years, we can produce 60 bottles, big bottles every day.
Wow.
So we've been able to maintain our equipment to ensure that they don't go bad. So everything is running. So
Doc, it's actually, I'm trying to get a hold of this interview because there's so much you're doing, and we need to just talk about the specific issues that you're throwing up. For instance, the dialysis unit that you talked about, I know that Asaba community at some point, seeing all the hard work that was going into Asaba Specialist Hospital, decided to get involved. Talk to us about it.
Okay, so setting up a dialysis section in the hospital was something I had as a dream. Yeah, but you know, the cost of dialysis machine is very, very, very enormous. So, and I just assigned a space in the hospital. I said, this is my dialysis unit. Yes, it was there for like 2 years. There was nothing in it. And then when one day my commissioner called me and said, Governor has said they are getting you dialysis machines. I was so happy. And I said, that's my space. And went to go and that was how we got Governor Sheriff provided us with 3 dialysis machines. And we set up the center. And today we are a major facility for dialysis because we get patients from across within and outside Asaba.
Not just the south, but for the southeast as well.
Yes. A lot of places, you know, Onitsha is just across. So a lot of them come from that direction. And what's peculiar about what we offer in our unit is that it's very affordable. It's
compared
the cheapest.
to
38,000 naira. So it's the government said we should make it affordable because one thing Governor, His Excellency is concerned about beyond making the services available is ensuring that it is affordable. Yeah, so it's accessible and it's affordable, which is something that is peculiar to Governor Sheriff Oborowori. So we started with the 3 dialysis units. We've been running, and there's room for expansion, obviously. So one day I got a call from His Royal Majesty, the Asaba of Asaba, and he said, please, do you need a dialysis machine? I was like, see this kind of question. So I just said, do you need a dialysis machine? I was like, sir, yes, I do. And that was how we got the dialysis machine. It was like somebody's bringing 2 for him, and we got the center set up. So that's how we got the dialysis machine in Asaba Specialist. The 4th dialysis machine. So we have 4 now. So we can dialyze 4 patients at the same time. Yeah, and we'll have 1 dedicated to patients who are HIV positive. Because you don't want to dialyze patients HIV positive, HIV negative with the same machine. So it's helped us because that one is reserved. So if there are 4 patients, we'll have to wait for the other 2 to be free. Because patients, I don't know, they actually prefer getting dialyzed in ASH. My staff are nurses and all of them, they are doing very well.
Perhaps you're also investing a lot in manpower capacity building. Is that what's going on there?
Oh, well, yeah, I'm a strong believer in capacity development. I don't believe in just do this and I don't tell you how. So we sponsor staff for training. We have several persons on outside posting doing residency in various specialties. We have nurses doing anesthesia, anesthetic nursing in Enugu. 3 of them will be running up this year because we have called the Japa syndrome. We decided to do our own home training for our staff. Of course, we know some of them will still live, but it's a gamble. So if you don't train them, you don't get the services that
Exactly.
they
The
offer.
quality.
So, and then we start residency too. We do residency in pediatrics, surgery, family medicine, radiology, and obstetric and gynecology. So we've produced a consultant pediatrician and I think 7 senior registrars in the course of the period we started doing residency training. So beyond that, we also send our staff out for trainings. We organize in-house trainings in the hospitals. We bring in facilitators. And I think recently we did the ACLS and BLS training for our health workers. We trained across board cleaners, health assistants, not just doctors and nurses, because the health assistant will be taking the patient to the scan room for scan, and the patient could just suddenly stop breathing. So they ought to know what to do. So I'm a firm believer in ensuring that my staff get the necessary know-how for them to be able to give me the result that I want. Yeah.
And then that tells me that any health worker, whether a ground staff even within the precinct of Asaba Specialist Hospital, gets some sort of training. Awesome. We're going to take a look at some of the clips because the interesting thing about your work is that you're documenting a lot of what's going on at Asaba Specialist Hospital. So we'll just take a breather, just relax. Let's take a look at the transformation that is ongoing at the Asaba Specialist Hospital at this time.
ahụ dị mma ndụ ogologo ezinụlọ anyị ga-adị mma ife anyị bụ ime taata ọ ga-aga ọfụma.
I wish to welcome every dignitary present here and the management and staff of Asaba Specialist Hospital. Today is a remarkable day in the hospital. It's a day that reflects a promise made and a promise kept. Your Royal Majesty, when you made the commitment to support this hospital with a dialysis machine, we received it with hope and expectation. Today, that promise is fulfilled and we are very grateful. The burden of kidney disease remains a major challenge. Across many centers, a lot of patients suffer from chronic kidney disease and have to have regular dialysis. And thankfully, last year, His Excellency set up a dialysis center in the hospital. So far, we have done almost 400 dialysis sessions over the past 8 months. As part of our contribution towards establishing and furthering the more agenda of His Excellency, we have made the dialysis as affordable.
All right. Well, that was the epic or historic visit of His Majesty the Asaba of Asaba. Of course, that was a morale booster for you at the time. And of course, we will also watch a clip of the hospital generally in the course of this interview. But now let's talk about your work as a pediatric consultant as well. Talk to us about your specialty and how you've been able to cater for that particular demographic that you set out to protect. You know, it was what led you into the medical profession in the first place. So talk to us about how you've been able to carry your personality as a pediatric consultant alongside being CMD.
Okay. Well, I'm a pediatrician. I focus on neonatology. That's children 0 to 28 days. That's my area. That's my niche.
The youngest ones.
Yeah. So I'm a mother too. So it just come naturally. My mother was a pediatric nurse, so I think I got the desire from her to be a pediatrician. And
did she practice in Nigeria? Because when you mentioned pediatric nurse, I'm wondering. So we have pediatric nurses in Nigeria.
Yes,
awesome. Interesting. Okay.
Yeah, she practiced UBTH. That's where she worked before she retired. So ASH has a very robust pediatric department. Charity begins at home. The residency accreditation started from pediatrics. So we got the accreditation to train residents in pediatrics department. We have produced a consultant pediatrician. We've produced 5 senior registrars in pediatrics department. And we have several persons going for exams. We have quite a number of consultants who are very connected to their patients, dedicated to their work, and with the free under 5 program of His Excellency, free maternal and free under 5 program, of the state government, we're able to attend to quite a very huge number of patients. Our delivery rates annually is about 2,000 per year, 2,000 beds per year. So it's quite a lot, and about 40% are cesarean section, because most patients are referred from around our
40% cesarean.
Yes.
Are you worried about that?
No, because of the referrals.
Okay.
Yeah, so most of the patients we have are referrals. So, all the primary health centers, the general hospitals, most of them refer their patients with complications to us because it's free. Yeah, so unlike other hospitals where they have to pay. So on the average, the patient may spend almost $1 million doing the cesarean section, but in ASH, it's free. So a woman just comes in, gives birth, free of charge.
Do they have to be Deltans?
No.
Okay.
As long as you reside in Delta State.
Okay.
In fact, we're at a point where you just come in, you register. We don't even ask you anymore if you are from Delta. That's what we're told. So the government just wants to ensure that the maternal survival is a very strong index of the growth of a population. So
that's right.
We are very concerned, and it's helped to reduce mortality amongst women of childbearing age. So aside that, we have a neonatal intensive care unit to manage quite a number of neonates. Because of my work, I'm no more able to, as much as I ought to, focus on my neonatal units, although I'm still in tune with my patients and my senior registrar and the other consultants there with me. We are still managing our patients. I'm still very committed to being a pediatrician. I still see patients, and I'm sure at the end of my tenure, I still am interested in focusing on my pediatrics. And as a consultant pediatrician, a fellow of the West African College of Pediatrics, the college has made me an assessor. So I was privileged to go and accredit Central Hospital Warri for pediatric residency. So they have a full accreditation. I was part of the team. It was a very wholesome experience, and I think that's growth in my primary niche, pediatrics, and aside from being CMD. So we do quite a lot. Every day we see over 100 outpatients in children's clinic. We also have the specialty clinic. So it's quite a busy facility. Every month, on the average, the entire hospital tends to about 10,000 patients. Yeah, and it keeps increasing. Yeah. Our admission rate is 1,000. Average 1,000, goes up, goes down, depending on the season. So
now, talking about doctor to patient ratio in Nigeria, the last time I saw an indicator of that nature, I think it was 4,000 patients to one doctor. Yes, are you worried about it, and how are you able to manage at the ASH?
Okay, well, it's not peculiar to Delta State. It's not peculiar to ASH. It's the entire country is facing a sudden surge in egress of health workers out of the country. A lot of persons have left the country. Many people are still living. So it's something we've had to adjust to. But it's especially becomes difficult when specialists leave. Yeah, because if it's the medical officers that leave, you can find a replacement without too much difficulty. Of course, there's difficulty too with them because all of them have gone to UK, Canada, and the rest. But for specialists like anesthetists, radiologists, physicians, they are so difficult to find. It's a problem. And I think it's something that the government, people who are in a position of authority, need to really sit down and develop a solution to make the country, make the health system attractive. Many people want to come home.
Of course.
Yeah, it's not better there in terms of your lifestyle, because there's no place like home,
and
really.
Freedom as well.
Yeah, freedom
and be acceptability, being accepted,
That's the truth. So a lot of people who are there, I talk to my colleagues, they want to come home, but they're worried. Security, the cost of living. Before you could live relatively well as a doctor, but now you have to have something else to do.
Exactly.
So what I do as a hospital, I have to bring in specialists that I don't have from other hospitals. So I engage them on part-time basis to fill in gaps. Then for some doctors, I could give extra encouragement, like employing their wives. So like if there's a consultant who I'm trying to get to come to my hospital to work, he has a wife who doesn't have a job, I'll tell you, I'll give your wife a job.
That's innovative.
Yeah, and they come. Yeah, and then for newly employed staff, doctors, and some other cadre of health workers, we could give you accommodation. I give a lot of them accommodation because the cost of rent in Asaba is also very high. So we give accommodation maybe for the first 5 months of your stay in Asaba.
So they can find their feet.
So they don't pay for the accommodation. So these are things we do to encourage them to stay in Ash. And then the ambience of the hospital is also very welcoming.
I saw the pictures. I'm sure we'll be seeing more of it.
Yeah.
It's
Even
beautiful.
the patients don't want to go because we've over the years focused on ensuring that the maintenance is top notch. So the cleanliness, the state of the wards, the amenities, we make sure that the place is inviting and welcoming for our patients and for our staff. And most of them stay. So it's a work in progress. When they leave, we start looking for more people to replace them. And
that's right.
By God's grace, so far we've been able to survive.
Absolutely. Yeah. Okay, so we're getting an insider look at what goes on at the Asaba Specialist Hospital from the woman who is navigating through the challenges and trying to find a way forward for the healthcare institution in Asaba, not just in Asaba, but the entire Delta State. And she has a lot more to tell us about Nigeria. I think we should listen to this clip, after which we'll continue. Let's get an insight on that.
I got to know program from my elder sister. She's the one had 3 children here, and it was free.
Lift me up.
It's a testament of the impact the state government, ably led by His Excellency Governor Sheriff Oborowori, has had in the area of healthcare, especially the impact on pregnant women and children less than 5 years.
I've used other hospitals. They were quite expensive, getting drugs and all that. Somehow I got introduced to this care and it was amazing. The care was perfect.
So far, I would say it has been nice. The vitals checking, the weight checking, the screening, and I would say they are doing a very good job.
And it's not just during pregnancy that they have access to free care. The care extends even up to 6 weeks after delivery.
My name now Kola for Priska. Since I get belle, I benefit free medication for pregnant women. Now I don't born, and I dey very happy. Everything are free, and they even tell me say I make I still they carry the children, they come back for free medication till they reach 5 years. So Governor Sheriff, I thank you. And since I born, I thank you. I'm very happy.
Wow. Now twins, she born. Awesome. Wow. So imagine these happy faces, and she doesn't look like she wants to leave, like you said. Talk to us. A lot of free things are going on there. You're also doing a lot of collaborations with NGOs. I saw something about Sickle Cell Day. You celebrate International Day. So you're also beyond national, trying to keep the national health index higher. You're also keying into international health observances, ensuring that these things trickle down. Talk to us about that.
Okay, so we've over the course of the years we've been fortunate because we've had a lot of collaborations that have been helpful to us. We've had a lot of donations, and we still welcome more.
Okay.
Yeah. So the former First Lady of Delta State, Mrs. Dame Edith Okowa, she set up a tertiary level sickle cell center, which does a lot of high-end investigations.
Is it within this administration? She came to do it within during her time. Okay.
During her time, but because I'm a firm believer in ensuring that what's put into my hands does not go bad. Okay. So the center is running, it's up and running, and we're able to sustain what she gave to us because we do newborn screening for genotype. during the course of the previous administration, we're given a machine that can do genotype testing at birth. You know, sickle cell disease is a very common condition in Nigeria. A lot of people don't even know their genotypes. Well, every child born in Ash gets to know their genotype
Right at birth.
Right at birth. So that's something that's a very important legacy that I'm proud of.
Okay.
And then we also do HPLC screening, a lot of things. We manage quite a number of sickle cell patients, and we celebrate significant days like Sickle Cell Day, Breastfeeding Week.
Yeah, I saw something like that.
Yeah.
You actually make a big deal out of these celebrations.
Yes.
Why do you do that? Because all those I don't quite see that it's not all the rage in this part of the country for people to prioritize international observances.
Well, it's a way of giving back to society.
Okay.
And giving back to my staff. For instance, World Health Day, I do annual free health check for all my staff. So this year we did quite a lot: dental checks, ECG. We did free enzyme hormonal assay. We did check their kidneys, fasting lipid profile. We did quite a lot for them. We even gave them free glasses. I think they are bringing them.
Why won't they keep working for you? So that makes their annual routine check.
Yes.
They are rest assured that the hospital will
free.
Wow.
Yes.
Wow.
So each person, I think at the end of the day, we spent almost 100,000 per person, because when you look at the cost of dental check, do scaling and polishing, refilling, do your eye check, replace your glasses, ECG, hormonal profile. When you put all of it together, it's quite a lot of money. So they're happy because they know that management is concerned about their welfare. And this is the third year we've been doing this.
Okay.
Yeah.
Wow. Sustained all this while.
Yes.
You mentioned something about cardiovascular health, I think, or is it the MRI?
Okay, MRI, yeah. Okay, yeah. So, every tertiary health facility should have adequate means to diagnose your patient. So before now, we unfortunately had to send our patients as far as Oka to do MRI. Benin. Yes, I'm not sure where the place is, but I know there's a place at Oka. We send our patients to. I can't remember the name of the place, even on the chat.
It should be the Amako General Hospital, right in the heart of Oka. Yeah, perhaps.
I have to confirm that it's a private place actually. But we send our patients there for MRI. Then there's one place at Mpo, then Benin too. So because we didn't have an MRI machine, and patients really needed to have that service. And you know, these patients are critically ill. Some of them don't survive the arduous journey to go down there. And we cried out to His Excellency. And graciously, he has provided a state-of-the-art, first of its kind in the entire country.
Wow.
3 brand new MRI machines, helium-free. So, you know, MRI machines, the drawback is power.
Oh, yes.
Nigeria has power issues.
That's
we need to be factual about it.
Very
they told him that there is this one that power does not affect. So even if, for instance, all of your backup means fail you, with the helium-free machine, the machine can go off and it will still be functional when you turn it back on. Before, an MRI machine should not go off. The moment it goes off, the very expensive helium will leak away, and you have to go and spend so much money to replace it. So we've been very excited about this initiative, because now we've commenced MRI services. And to start with, we did free MRI for patients for 3 days. I think 42 persons benefited.
Wow.
And the average cost of MRI outside is 200,000 per view. So we did that for 42 people. They were very happy. They are very grateful to His Excellency. Some of them, my staff, who could not really afford to have an MRI done. And beyond the 3-day free period, we are also giving it out at a very affordable rate, so starting with 120,000 per view, which I think is the cheapest anyway.
And that's it.
Yeah, this is an MRI suit, not mine.
Okay.
It's an MRI suit.
Okay, this is what it looks like.
Yes, this is what it looks like.
And then what does it check?
So it checks basically the entire body. So it depends on what you are looking for. The brain, patients with stroke, with tumors, cancer, can check the bones. Patients who have back pain. Lower back pain is very common in our environment.
That's
when
right.
the older people got poor posturing and poor lifestyle practices, they are predisposed to back pain. So a lot of persons come with back pain. So you can look at the spine, People who have accidents can look at the abdomen, the heart. It can detect that somebody has what do you call it? An embolus in the lungs. Yeah, so it's all those people that have I don't know the layman's term to use now, but a blockage in the lungs or in the heart can detect all of that. So and this machine has capacity to do all that. So I was looking at the films that we've developed. So far, we've done over 60 MRI scans in the past 2 weeks. We just started actually. Yeah, we just started. So 2 weeks, and I was looking at the images, very clear. Very, very clear. Very.
So the investigations, you can actually see exactly what's.
Yeah, and patients don't have to travel that far anymore, and we can make our diagnosis faster. So we are happy. Clinicians are happy because we are able to render the service to our patients, and it's affordable.
Okay, talking about SDG 3, quality healthcare, achieving it 2030 is just 4 years away. But relatively, judging by what's going on across the country, the rest of Africa, and where do you think Delta sits with all the intervention in healthcare? Because relatively, I think that Governor Oberori has prioritized healthcare delivery. So would you say that Delta is helping Nigeria inch closer to the goal?
Yeah. Very well, very well. I mean, I would say that it was like the commissioner said a few days ago during the economic summit, the maternal mortality rate has dropped, and it's directly related to the fact that access to maternal care is free. So women don't have to bother about spending money. They don't go to TBAs and all of those places. They go on safe birth practices. They just go to the hospital. They don't spend anything from time of booking down. So that's one area. Maternal mortality has reduced. Under 5 mortality has also been reduced because of the initiative of free under 5 care, and then establishing and equipping the facilities around the state. So, for instance, the dialysis machines provided for ASH for Asaba Specialist Hospital was also provided for Central Hospital Warri and Delsut. So across the 3 senatorial districts got dialysis machines from His Excellency. He also provided all of us, these 3 facilities again, ventilators, because patients who require ICU care, some of them need to be placed on ventilators. So it's provided that. And then, okay, that's my dental clinic. Because I have approval to spend my IGRO, graciously approved by His Excellency, I'm able to do a lot. So this dental clinic was set up with IGR, and we attend to quite a number of patients. That's a mobile dental X-ray for our patients, so we can do our X-rays of the teeth in the dental unit, and we've also set up therapy units. A lot of things have been done due to the fact that each facility is able to use its IGRO to run itself, but the state still pays for salary, and then also still does those massive infrastructural projects that it really cannot accomplish. The physiotherapy department was also set up fully with IGRO. So all of these services that His Excellency has made available to patients has helped to reduce the negative indices of health in the states, and it's reflecting in the well-being of citizens and helping the larger community, larger country achieve its goal of attaining, to a certain extent, the SDGs. And beyond the tertiary facilities, I think recently several primary health centers were renovated and equipped, and then there's a massive employment that just happened recently of about almost 700 health workers across all of the facilities, and then training too. So Delsut is training residents, it's training medical students. Central Warri is doing the same thing. We're doing the same thing too. And then beyond that, we also have accreditation and a partnership with Novena University and then Sadebe University to train medical students. So by all intents and purposes, ASH is a teaching hospital in practice. For in name, it's still a specialist hospital, but we do everything that teaching hospitals do. So we have nursing students, medical students, across, all of those cadres. So,
Okay, but I know that you're looking towards that soon enough, perhaps the teaching hospital status will be well established, and I know that you're not too far from there. Wow.
Yes.
We are almost out of time, but just a lot more to talk about. That means you have to come back, Doc. I know you're very busy, but you will have to come back because there's so much more.
Actually.
Talking of prevention, I wanted you to talk more about prevention, but because of the collaborations you're doing, celebrating International Days, I know that most of those programs are for sensitization.
Yes.
But we'll talk about that when you come back. But what is your word to Deltans, perhaps even to the government, your word to everyone, all stakeholders in the health project? How do we accelerate towards Vision 2030 in the healthcare system?
Okay, well, I think that there's need for more collaboration. There's so much more to be done, actually. The state is huge. There's a lot of there's diversity in the state, a lot of local governments, tribes, and all of that. But I think that beyond all of that, we all need to look at the bigger picture, which is offering healthcare that is affordable and accessible to everybody. So no matter your class in society, I envision a society where everybody can just come to this health sector as it obtains outside of this country and access care. You don't have to know anybody, or you don't have to have any special connection to anything. Just access care. So I hope that policymakers will get to a point where healthcare is across all strata, primary, secondary, tertiary healthcare, available and accessible to the common man, to everyone.
Coming from Dr. Peace Igosewe. Thank you so much, Doc.
Thank you.
Yes, we appreciate your coming here. She is the Chief Medical Director of the Asaba Specialist Hospital. Wish you a great future as you continue navigating the hospital to greater heights.
Thank
you so much. Well, achieving SDG3, quality healthcare is not only about treating illnesses we've learned today. It is mainly about prevention as well as early, proper and affordable intervention, which we have seen in the case of the Delta state government. A healthy Africa overall begins with stronger and evolving healthcare systems. There is therefore a need to sustain the ongoing transformation of the Asaba Specialist Hospital and other healthcare institutions across Delta State, Nigeria, and Africa. This can be achieved by appointing visionary healthcare managers, administrators, and providing requisite resources and infrastructure for effective and efficient healthcare delivery. Well, that's it on this edition of Your Voice Africa. If it affects women and girls, it affects the entire society. It's up to us to speak up, support, and build a safer world and a more inclusive Africa. Your Voice Africa will be back same time next week. I am Ife Arono. Stay impactful and stay healthy. Bye.